We lived in a situation of stress for a long period, and now we all need to be helped. Oncologists were particularly stressed, and they had to reason about their forces, their capabilities of going on and on, working every day and dealing with stress and with the ideas that the patients needed to be supported more on the psychological point of view. On the other hand, we have the patients. This tsunami affected everyone, every patient, in a form of post-traumatic stress syndrome. What happened to them and what they need more? They need to understand that this was completely a shock. And after a shock, it's so important not to avoid the idea of what happened, but they need to work on their experience, on their feelings, on their perceptions of negative emotions. How we can recognize if we are affected, or we are at risk of post-traumatic stress syndrome, if we have nightmare, if we are isolated from the others, if we are not able, for example, to live with other people. If we are aggressive, we have to understand and recognize if we are sleeping as before, or for example, we are no more able to sleep. Patients know very well what is a post-traumatic stress syndrome, because it's exactly what they experience after a diagnosis. But since they are patients, they know very well that we can live, and not only survive, but live in a better way, changing values, changing beliefs, improving our quality of life, doing better choices. So, in a word, they know that we are resilient. The resilience is the key for going on, is the key for a better opportunity of living. Patients can ask help directly to psycho-oncologists. But what we have not to forget is that even the oncologists could be helped, and they need to be helped, because this stress was very high for everyone, nurses, oncologists, doctors, and patients. If we are in burnout, we cannot help our patients in the best way.